Okay, so hello and welcome to our 10 of Healthcare Solutions webinar. Today we're going to be presenting on HIPAA compliant texting, the do's and don'ts. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for ITENIV. I'd like to take a moment to explain the process for today's presentation. I'd like to mention that this webinar will be recorded. Next, for those of you who aren't familiar with ITENIV, I wanted to share a bit of who we are with you. We've been in business as ITENIV since 2003, but we've been next-gen users since 1997 EPM version 2.3. We specialize specifically in next-gen healthcare. Our development team knows how to get data into, out of, and around next-gen to customize it and tailor it to meet our clients' unique needs. Our purpose in life is to create delighted clients by helping them get the absolute most out of their next-gen software investment. It is our passion to provide solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. We really do everything next-gen, from consulting to hosting, customization to support, and we have two next-gen add-on productivity solutions, ShareGuard and Refund Manager. We're here to help. Next, I wanted to bring your attention to our upcoming webinars. We're going to be presenting a three-part webinar series, Improving Federal Security Initiatives. Improving Federal Security Initiatives, the True Impact. The first one will be on July 29th, titled Meaningful Use Audits, True Client Experiences Revealed. In it, we're going to share real-life client experiences on what the audit process was actually like and reveal additional information providers can expect to be requested and to provide, common reasons for failing an audit, and review best practices to prepare your practice for an audit, as well as a brief overview of the audit process. Okay, so going back to HIPAA-compliant texting. At the end of the presentation, we're going to open the floor up to questions from you. We're going to answer all the questions at the end, but you may type them in the questions area of the webinar control panel whenever they occur to you. For your reference, we will also be emailing out links to the recordings and PDF of the presentation later this week, as we do with every webinar. Finally, for audio clarity purposes, everyone's phone is going to remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. So without further delay, I'd like to introduce our presenters for today, Lindsay Lanning and Cindy Kincaid. Lindsay Lanning originally joined us from the Ohio State University intern program while she was getting her degree in Health Information Management Systems. After graduation, Lindsay joined our team as a Healthcare Informatics Coordinator, where she spends her time immersing herself in the ever-changing healthcare IT environment and educating the rest of the company on new issues and trends in the industry. Cindy Kincaid is Vice President of Consulting Services at ITENIV and a Certified Practice Management Executive. With over 25 years in the IT healthcare industry and 9 years with ITENIV, her experience runs wide and deep. This makes it possible for her to provide the insights needed to help healthcare organizations experience great success, no matter what the challenge is. Okay, so Lindsay, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Great, thank you, Chelsea. Hi, everyone, and thank you for joining us today for our webinar, HIPAA Compliant Texting, the Do's and Don'ts. Today, healthcare providers are increasingly using mobile devices to receive, store, process, and transmit patient clinical information. These mobile devices are becoming as prominent in the healthcare setting as they are in our everyday lives. However, there are significant risks associated with exchanging patient information if message transmission is not secure. This is especially true due to specific mandates such as HIPAA. Mobile health will be a significant factor as we move toward patient-centered care and value-based reimbursement. This new tool promises to enhance care and improve efficiency. However, as healthcare professionals, it is our responsibility to make sure patient information is still properly protected and compliant with HIPAA. So in today's webinar specifically, we will look at the latest news involving healthcare texting, since there have been some pretty big headlines lately. And then we will go through a very brief HIPAA recap just to refresh memory on who HIPAA applies to and what specific rule governs clinician texting. And finally, we want to provide viewers with best practices for achieving HIPAA-compliant texting and explore a thoughtful approach to integrating mobile technology in your practice. Specifically, we will look at organizational policies to put in place, key product features to look for, and best practices following integration. Now, I know many of us may not realize the staggering growth of mobile technology in the healthcare industry this year, so I looked up the results of the 2015 HIMSS Mobile Technology Survey, which reported that 90% of respondents are utilizing mobile devices within their organization to engage patients in their healthcare. 57% of respondents indicated their organization has a mobile technology policy. and another 36% reported that their organization is presently developing a mobile technology policy. 47% of respondents indicated that implementation of mobile services for access to information is a high priority at their organization. And in another study, more than 3 out of 4 clinicians reported professional usage of smartphones. These numbers truly speak for themselves. Physicians want this technology available to them while providing care, and we can't ignore it or put it off any longer. Now, if you still aren't convinced how popular this is becoming, take a look at some of the headlines over the past year. Federal Trade Commission has studied mobile device security practices. The Joint Commission lifts ban on clinician secure texting, and that was May 1st of this year. Federal Trade Commission releases new guidance for developers of mobile health apps. The CIO's Guide to HIPAA-compliant texting, and NIST guidelines for securing EHRs on mobile devices. One that I think has the biggest impact on the healthcare community is the Joint Commission lifting their ban on texting. This article announced that effective immediately, the Joint Commission revised its position on the transmission of orders via text messaging. If we look at this a little closer, in its May newsletter, the Commission said it's seen enough safe and secure mobile health communication platforms to give docs and nurses the green light to text. Specifically, they stated practitioners may text orders as long as a secure text messaging platform is used and the required components of an order are included. Sending orders via text messaging was prohibited due to concerns about using personal mobile devices to send unsecure text messages between providers. In addition, texting applications were unable to verify the identity of the person sending the text or to retain the original message as validation of the information entered into the medical record. At the time, the technology available could not provide the safety and security necessary to adequately support the use of text messaging for orders. The Commission is recognizing that several secure text messaging platforms have been introduced, giving clinicians a safe and secure means of texting with their colleagues to coordinate care. When the Joint Commission first instituted the ban 5 years ago, healthcare secure text messaging options were relatively new and had not been fully integrated into the industry. However, recently went back and revisited the area and has created guidelines around how healthcare organizations can securely transmit information and communicate. These guidelines set forth by the Joint Commission are specific requirements that must be followed so that text can be integrated into the patient's medical record in a compliant way. The Commission stated the platform used for texting must include a secure sign-on process, encrypted messaging, delivery and read receipts, date and timestamp, customized message retention timeframes, and a specified contact list for individuals authorized to receive and record orders. In addition, the Commission said any healthcare provider allowing text messaging should comply with Medication Management Standard, which establishes a protocol for medication orders and steps to take when an order is unclear and incomplete. For now, the Commission advises providers to develop an attestation documenting the capabilities of their secure text messaging platform, define when text orders are or are not appropriate, monitor how frequently texting is used for orders, assess compliance with texting policies and procedures, develop a risk management strategy and perform a risk assessment, and conduct training for staff, licensed independent practitioners, and other practitioners on applicable policies and procedures. This is a tremendous step forward for healthcare communication, with enormous benefits for healthcare professionals and their patients. So I think we all understand healthcare secure texting and secure messaging options are quickly increasing in popularity for covered entities. Providers are looking for secure, convenient ways to communicate internally, and it's our duty to ensure federal regulations that relate to mobile device usage are considered. So what regulations currently exist that apply to clinician texting for healthcare purposes? Well, we have HIPAA, specifically the HIPAA security rule, the omnibus rule, the HIPAA communication update, which I'll actually touch on later, and HITECH, which contains the breach notification rule. So in order to fully understand how to achieve HIPAA-compliant texting, we need a brief recap. First off, HIPAA has 3 parts: the privacy rule, which describes what information is protected and how protected information can be used or disclosed. The security rule, which describes what safeguards must be in place to ensure appropriate protection of electronic protected health information. And the breach notification rule, which governs what to do if PHI is breached. Now, who has to comply with HIPAA? First is covered entities, which are healthcare providers, health plans, and healthcare clearinghouses. And of course, business associates. And this is where the omnibus rule comes in, because this allowed HIPAA to be applied to covered entities' business associates. So I already mentioned before, the HIPAA security rule is what specifically applies to mobile devices being used in the healthcare setting. And the HIPAA security rule is in place to ensure the confidentiality, integrity, and availability of all ePHI that a covered entity or business associate creates, maintains, or transmits. The security rule lays out 3 sets of safeguards. That's administrative, technical, and physical, which we're actually going to look at next and how each of them can be applied to mobile devices. First off is technical safeguards. And technical safeguards are those we would associate most with mobile device security, since they are the actual technology that is used to protect ePHI and control access to it. So some major points to address here are access control. Ensuring only authorized personnel have access to ePHI is extremely important and takes into account things like unique user identification or authentication, think codes or a fingerprint to gain access, break the glass protocol, automatic log off or lock of the device or application. Also audit controls, being able to audit when a device is connecting to a network or being able to audit actions completed by a certain user. In general, you should have the same audit controls and capabilities you have in your EHR system for your mobile device. Also scanning and testing security measures and transmission security, primarily focusing on encryption. Next, we have administrative safeguards, which are administrative actions and policies and procedures to manage the development, implementation, and maintenance of security measures to protect ePHI and to manage the conduct of the covered entity's workforce in relation to the protection of that information. Some administrative safeguards that are most applicable to mobile devices are the security risk analysis, which we will talk about next, workforce security, so authorization, clearance, and termination policies, information access management, specifically access authorization, workforce training is huge, a business associate agreement, and security incident procedures such as reporting, communication, and backup plans. One, if not the most important safeguard, is a security risk analysis. An SRA is the key to being HIPAA compliant because it assesses all potential threats and vulnerabilities to ePHI, which in turn allows you to determine what safeguards to put in place to reduce that risk. So key questions to ask yourself are, have you identified all ePHI? And have you identified all access points where employees could input ePHI in the system? The biggest mistake a covered entity or business associate can make when trying to be HIPAA compliant is not updating their security risk analysis once mobile devices are integrated into care. Just to give you an idea of how much thought should go into creating a security risk analysis, let's look at an example of how a covered entity or a business associate would go about handling a stolen mobile device. So let's say an unauthorized user gets a hold of a mobile device with ePHI on it through theft at a drugstore. Was the device used to access PHI? Was PHI saved on the device? Are you able to terminate access to PHI on the device? Is the PHI backed up somewhere else? And can you remotely delete all sensitive information? You need to ask yourself these questions and make these considerations for your own practice. Now I know most of us sit and think, this won't happen to me, it never has. But according to HHS, there were 120 large breaches involving a portable device, excluding laptops, as of August 15th of last year. And 51% of them were due to theft, affecting more than 122 million people. It can happen to anyone, and we need to have the proper safeguards in place. The last safeguard being physical. With this, we typically think of locked doors, maybe not as extreme as this picture, but some people may be wondering how physical safeguards can apply to mobile devices since, well, they're mobile. But there are ways such as facility access controls, so key access to buildings where these devices are being used. Also device and media controls, such as a process to dispose of mobile devices or securely wiping before reuse, as well as data backup, ensuring proper storage and device backup. Now, in order to complete our review of HIPAA, we will touch on the HIPAA communication update. Basically, in 2013, the government set forth an electronic communication update to HIPAA. The new HIPAA policy was introduced to eliminate the risk of patient health information being compromised during the sending or receiving of sensitive data via email or text, while patient health information is kept on a portable mobile device, so a cell phone, tablet, an iPad, smartphone, etc. The HIPAA security rule requires organizations to address text messages as part of their comprehensive risk analysis and management strategy. Based on the risk analysis, the organization must determine the appropriate administrative, physical, and technical controls to mitigate the risk of sending EPHI via text messaging. Another area of compliance impacted by texting is the HITECH requirements for breach notification. Devices used for texting, such as smartphones and tablets that we just went over, may be lost or stolen. So the importance of ensuring HITECH compliance in the event of a breach is an area that must be reviewed in the context of text messages that may reside on the compromised device. So what does this all mean, and how will it affect you? Well, the revised HIPAA policy accounts for the lack of security on many portable mobile devices, and the fact that few portable mobile device owners use passwords to protect sensitive patient health information stored on them. The new HIPAA guidelines also address sensitive patient health information that is transmitted by text to or from personal portable mobile devices, which is not encrypted, and which should now be deleted if no encryption security measure is in place. New HIPAA texting rules have also been introduced to safeguard patient health information when it is sent, received, or reviewed by the portable mobile device owner over an unsecured cellular network or public Wi-Fi. Essentially, it's imperative you discuss how you communicate PHI, how you're controlling who has access to it, how that information is transmitted and received, and how it is consequently protected when it is stored on a portable mobile device. So keeping HIPAA and all of its requirements and safeguards in mind, we ask ourselves, where do we go from here? The risks associated with sending EPHI via unencrypted text messaging are significant, especially given the climate of rising enforcement of compliance with HIPAA and HITECH. However, there is a high demand amongst healthcare providers to use text messaging as a fast, convenient way to communicate and collaborate with colleagues. So the challenge is, how should healthcare organizations evaluate and select the mobile health solutions that best support clinical outcomes, coordinated care, workflow efficiency, patient engagement, and population health? How should healthcare organizations protect the security of information shared on mobile devices? The solution? Find a solution that allows providers to stay HIPAA compliant, but also utilize technology like providers should in the 21st century. Healthcare should not be sheltered from the proliferation of mobile health. Healthcare professionals need safe and effective solutions that ensure interoperability and the security of PHI. So how do we accomplish this? As healthcare secure texting and messaging options evolve, providers must ensure they implement the technologies properly. We looked at the CIO's Guide to HIPAA-compliant texting and found the key steps an organization can take to enable clinicians to use text messaging while ensuring that HIPAA and HITECH compliance requirements are met. And they include step 1, policy, establish an organizational policy. Step 2, product, identify an appropriate text messaging solution. And step 3, practice, implement and actively manage the text messaging solution. So if we follow these steps, we will first look at policies. which ultimately translate into various administrative safeguards to ensure HIPAA compliance. So step 1, texting policy. An effective text messaging policy must apply to an entire organization. This includes its employees, physicians, and all other workforce members. A policy for secure text messaging should include the following key statements, which establish the minimal requirements for the organization. The first, defining a text message. An example would be, text messages are electronic communications sent with a mobile device or computer system. Text messages can transmit photos, videos, and written word formats of communication. If the content of such a message contains EPHI, then the text message must comply with HIPAA requirements. And the second being a blanket statement regarding the sending and receiving secure text messages. So you could do something as simple as, all text messages containing EPHI must be sent in a secure, encrypted, and approved format. These seem really simple and should just go without saying, but to be HIPAA compliant, these statements need to be written out in a policy. So we actually have a list of example policies an organization may want to put in place that were mentioned in this guide for HIPAA compliant texting. And one that we found is, users should not send text messages containing EPHI unless the text message is encrypted both in transit and at rest using an appropriate application. Additionally, it drills down into some further details saying the text message must be communicated from the sending device through the mobile provider or a software application to the recipient's device in an encrypted manner. The encrypted text message should not be decrypted and stored on the cellular provider system in ways that can be accessed by unauthorized personnel. If an employee wishes to send EPHI via text message to another employee, both the sender and the receiver must fulfill both the encryption requirements for the message in transit and at rest. Another policy may say, all users who wish to send or receive text messages containing EPHI must ensure that the IT-approved secure text application is approved by the IT department for such purpose. Again, specific requirements may include the employee must submit their mobile device number with the help desk or the IT department to ensure that proper inventory is maintained of all mobile devices sending or receiving EPHI. Mobile devices used to text EPHI must be properly sanitized upon retirement of the device. The IT department must securely wipe all mobile devices when they are returned. If an employee is using a personal device, they must contact the IT department to securely wipe the device prior to returning it to their cellular provider. An effective policy for the use of secure text messaging should mandate that the following safeguards be implemented by employees sending or receiving messages. The mobile device or secure texting application must be password protected, and this feature must never be disabled. The mobile device must be configured to lock automatically after a period of inactivity. You could suggest 5 minutes, you could suggest 10 minutes, whatever your organization would like. All text messages containing EPHI should be limited to the minimum information necessary for the permitted purpose. So multiple identifying factors such as full name, date of birth, medical record number, even your social security number should not be used. It's important to set guidelines that must be followed when using text messaging, such as number 1, confirm the recipient of your text. Number 2, confirm delivery and receipt of the text. A confirmation receipt that the information was received is ideal. Do not use shorthand or abbreviations. Review text prior to sending to ensure accuracy. Beware of autocorrect functions. All text messages that are used for clinical decision-making are documented in the medical record. Delete all text containing EPHI as soon as the information is no longer readily needed. And other policy statements to consider and adopt based on your organization include report all unencrypted text messages that are received or sent out that contain any EPHI immediately. Report all text messages that are sent to the wrong intended individual immediately. Every policy and procedure revision and replacement will be maintained for a minimum of 6 years from the date of its creation or when it was last in effect, whichever is later. And login audit information and logs relevant to security incidents must be retained for 6 years. So a lot of examples on some solid foundational policies to put in place to get your organization on the right track for HIPAA compliant texting. Step 2 on your way to secure texting is looking at specific product and vendor requirements. And these are very similar to the technical safeguards we found in HIPAA. Some key requirements. To ensure compliance with HIPAA requirements and enable clinicians to use text messaging securely, organizations should work with vendors that meet all of these key capabilities. Authentication methods. This solution should provide secure authentication methods to ensure authorized access. Password management. Passwords generated or used are of sufficient complexity, and secure password change or reset mechanisms are in place. Administrator rights, login monitoring. So all login attempts, both successful and unsuccessful, are logged and monitored, and accounts are locked after a defined number of failed login attempts. Automatic log off. Users are logged out of the application after a period of inactivity. Access control. Controls are in place to ensure users can only access messages they sent or received. Unique user identification. Users are uniquely identified throughout the application, and all actions can be tied directly to these IDs. That's key for auditing purposes. Access control audits. The ability to generate reports on access controls, including administrative actions. Account authorization and establishment, so only administrative users have the ability to create new accounts. Account termination. Accounts can be terminated by an administrator, and terminated accounts are prohibited from accessing any previous messages. Audit capability. Logs all user actions related to authentication and message access, and logs are timestamped for easier correlation. Transmission security, we've already touched on encryption. Protection of data on the mobile device. The messages stored on the mobile devices are encrypted. This also includes any information such as the staff directory information and backup processes. All messages are archived to allow administrative access, and message archives are encrypted and stored securely. You may also want to think about message retention time to have that be customizable to match your organizational policy. So we have administrative and security requirements to look at as well. So secure notifications. Message notifications displayed do not include any EPHI. So when a text pops up on your screen in that little banner that we're used to, it shouldn't show any PHI until you open it using your secure login or your password. Remote wipe for lost or stolen devices. Administrators can disable accounts, which revokes access to all messages and information. So you see that little screenshot on your screen. And set message lifespan. This enables administrators to set how long messages will persist within the application on a device. Finally, vendor requirements, which are absolutely required, is a trusted business associate agreement. A vendor must provide a business associate agreement for secure texting solutions. And then industry experience. You want someone with several years of experience in healthcare security with a good reputation. Remember, you're responsible for having a business associate agreement on file to be HIPAA compliant. And you want to partner with someone who has experience in healthcare and with HIPAA, because we're finding more and more with these phase 2 HIPAA audits, if your business associate fails an audit, it flags you. It increases your odds of being selected for one if you're their covered entity. Now, we went over very specific product and vendor details, but if we take a step back and look at the overarching principles and features that a stakeholder should be looking for in a clinical communication platform, we will better understand how HIPAA risk can be minimized, medical errors reduced, and workflow efficiency improved. I think the first and most important essential feature is obvious, It speaks for itself, and that's security. Security is half of the HIPAA compliance equation. It's largely about encryption, and encryption is basically just the conversion of data into a form that cannot be easily understood by an unauthorized user. For a texting app in healthcare, this should apply to messages both at rest and in transit. This means that encryption should be in place according to federally validated standards at all levels. That includes the database, transmission, and within the app. HIPAA compliance goes beyond security and encryption, however. The HIPAA privacy law was enacted to protect the privacy of an individual's health information and govern the way certain healthcare providers and benefit plans collect, maintain, use, and disclose PHI. HIPAA compliance then really comprises of security, control, and auditing. So look for these features to ensure your secure texting solution has proper auditing and control measures in place. Remote wipe capability, auditing, a secure network, management of attachments. This one we have not hit on yet, but that's really keeping the data within the application. That's a big part of control. Copying and pasting data should be restricted, as should the ability to save photos and attachments outside of the application. At the very least, organizations should be able to turn these functions on or off at the network level. And then finally, authentication, which we've touched on. Bottom line, security control must work together for an application to be HIPAA compliant. So once you have a solution that's secure, controlled, and can be audited, you need to look at its integration capabilities. Because a clinical communication platform is only useful if everybody's on it. Expect the clinical communication platform to integrate with your EHR, so providers should be able to push notes out to your EHRs and receive selected notes on the mobile. Phone directories, department and network contacts should be immediately accessible to all users. Labs. Your communication platform should have the capability to view, send, and receive critical results. In-house phones. It should be compatible with in-house phones for efficient communication. And integration with a picture archiving and communication system, which allows CT scans and MRIs to be sent to physicians for immediate viewing on their mobile devices. Patient care is inherently tied to lab results, call schedules, emergency alerts, etc. So all of those systems need to be accessible from the texting platform in order to work effectively. Beyond the security aspects related to protecting private patient information, healthcare messaging must also address other features, such as patient safety precautions, coordination of care features, scheduling, secure photo sharing, notifications and read receipts, customizable sounds, and possibly prohibit the copy and paste function. These are all things to consider that may be a normal part of your everyday mobile device use, but need to be tailored for clinical use. Take patient safety, for example. When using standard texting, all messages are grouped together in one thread according to the contact. That's convenient for personal texting, but it leaves dangerous room for error when discussing patient orders. Something to consider would be an application, which this application specifically mentions Doc Halo. We haven't really talked about any specific products because we haven't been able to vet them ourselves. We'll mention a few more later. But this application actually enables providers to start new threads when they begin discussing new patients. So grouping message threads by patient or maybe by topic instead of by contact ensures that there will never be confusion that could result in a medical error. So a lot to consider when picking a solution. And finally, step 3, practice. Tracking and monitoring. These are huge. Once a secure text messaging solution is deployed, it's critical to ensure active management to maintain compliance with HIPAA and HITECH requirements. This includes monitoring log files and other audit information to ensure appropriate use. Specifically, IT administrators should track and monitor administrator activities related to managing users and policies, ensure that authentication events are appropriately captured, and ensure that message read receipts are timestamped. Importantly, organizations should ensure that a proactive audit practice aligns with an established policy and is implemented for managing the secure and HIPAA-compliant text messaging framework. Along those same lines of tracking and monitoring compliance, the Federal Trade Commission, in conjunction with the Office of Civil Rights, the Department of Health and Human Services, ONC, and even the Food and Drug Administration, created a new free web-based tool to help developers of health-related mobile apps understand what federal laws and regulations may apply to them. The guidance tool includes high-level questions for developers on the nature of the app, how the app functions, data the app collects, and services it provides to users. Based on the developer's answers to those questions, the guidance tool will point the app developer towards detailed information about certain federal laws that may apply to the app. These include the FTC Act, the FTC's Health Breach Notification Rule, HIPAA, obviously, and the Federal Food, Drug, and Cosmetics Act. At this point, we really know what to look for in a HIPAA-compliant texting solution, but the other half of a successful clinical communication platform is a thoughtful approach to integrating mobile technology in your practice. And I will go ahead and turn it over to Cindy Kincaid for this section. Cindy?
All right, thank you, Lindsay. Okay, as we know and as we've kind of demonstrated in this slide, the mobile health industry is in a period of rapid adoption and evolution. Healthcare organizations need to integrate mobile device use into their broader efforts around healthcare reform, but without sacrificing the privacy of the patient. To do this successfully, we need to consider issues such as clinical decision support, workflow efficiencies, communication and coordination, patient engagement, and of course security. We have to ask ourselves, is it secure, focused, integrated, a source of clinical support in order to achieve better health outcomes? Is it easy to use, a strong platform, and is it flexible? So if we look at mobile device integration, we want to consider the three aspects: people, technology, and process. And that's what we will need to do in order to have a successful integration. So first of all, let's look at people. We need to have centralized deployment and controls. We need to have user-focused policies, and we need to have training. And we know that HIPAA requires policies and procedures and training, but training should be meaningful and cover all application usage. Acceptable use policies, it also includes your wireless network management. For example, you shouldn't be doing certain things over guest Wi-Fi networks, operating system behaviors of the device. All of these devices are different and they have different controls. And then we want to be able to really understand whether we can disable, enable notifications, or any other important information that really is beneficial to the end user. Ultimately, the weakest link in any security program is the user. And I think we've all seen that with a lot of the different viruses and encryption controls that people are putting in, all kinds of things, and adding mobile devices just adds to that risk. Then we have to look at technology, the mobile device management software, device controls, network controls. And then finally, develop our processes, monitor, detect, and act. How do we handle security audits? And then do penetration testing. And those are just some of the examples. So security controls for mobile devices. Well, we want to talk about our, first of all, access controls. Can we restrict access to the device for only those users authorized? Are there audit capabilities? Can you record and maintain logs of access and other events within the network? Can you get a copy of the text? The device integrity. Can you ensure accuracy and reliability of the device? User authorization. Can you control individual access to the device and make sure the user is who they say they are through identification, either with passwords or fingerprints? Can we do transmission security? Can we ensure the security of the data in transit to and from the device, and then back up the data? Is there an ability to have the data backed up, and is it accessible if the device is stolen, lost, or destroying? It's no longer enough, if you're going to be using this in your environment, to have the swipe passwords or the 4-digit passwords that will allow you to get into the device. It's not, you're going to have to go much further than that. If we focus on these items, we have ensured layered security that encompasses the device for the application and the network. So you have to have the application, the network, and the device all covered, and make sure your policies actually address these. So let's talk a little bit more about user access and authentication. Layering on security over the usual device settings. Again, you must have stronger passwords. So you need strong device passwords. You should have double authentication for device and application. Earlier in one of the slides, Lindy mentioned that we have to follow the rules for medication and prescribing. I think everyone on this call, depending on your state, knows that those vary, but they are simply not a lot. They are a lot more than just putting in a simple password. So double authentication for the device and application. We want to have multi-factor identification such as passwords, PIN, and fingerprints. And then you need a timeout or auto lock after multiple failed attempts. Additional items to address is we need to be able to store, are we storing sensitive information? And if we are, is it accessible for such as confidential information about AIDS, behavioral health, women's health, all of the things that are considered confidential in your EHR? Are those items even available to participate in a texting program? Do you have the ability to download apps? If you're having your own device, or you're providing devices to your participants, are you going to whitelist apps, or are you going to be able to blacklist apps? Do you want to allow them to download any apps? Do you have the ability to alter factory settings? And how are you going to handle or address the use of social media from the devices, particularly if you are using your personal devices, or as we call them, BYOD, or bring your own device? So additional risks to consider as well are, is the phone connected to a personal cloud? When you're working with this, do we need expanded business associates? Have we got more business associates to deal with? App developers, private cloud providers, mobile carriers. If you're using some of these services, not only for this type, but for other things, you have to have, as we talked about in some of our earlier telemedicine, you actually have to have a business associate agree with the provider that you're working with if you are going to be using it for EPHI. Other bring your own device concerns are you're going to need to have clear policies and procedures for the user. Do you have the ability to separate business and personal? Have you ever, anyone on this call, I know I have, I've received them and I've sent them. Have you ever been frantically texting between people and sent the text to the wrong person? Or you're talking to someone about maybe going shopping tonight, or maybe you're answering a business question. Those are the type of things you have to consider if you're going to allow the use of personal devices. And then finally, the ownership of the device, and then recovery of data if in the event that the device is turned in, replaced, or stolen. So, can you use texting? I mean, that's really what this webinar is all about. Basic question is, can you use texting? So, the Department of Health and Human Services has answered this frequently asked question. The question is, can you use texting to communicate health information, even if it is to another provider or professional? Their answer is your organization may approve texting after performing a risk analysis or implementing a third-party messaging solution that incorporates messages to establish a secure communication platform that will allow texting on approved mobile devices. And with that answer, I'm also going to tell you one of the most common mistakes when integrating mobile is not understanding your security risk analysis to look at threats and vulnerabilities after you've added the mobile solution. It is not enough to rely on technical safeguards. Although they are important, you need policies, procedures, and training, and you need to be able to demonstrate that you have done these. So, is it worth it? We've talked about a lot about all of the things that you can do and all of the things that you have to do, and hopefully we've maybe scared you a little bit about what you need to put in place, because these audits are real. We've got some other webinars coming up, and we'll give you some real-life examples. They are real, and they are not just happening to really large groups. They're not just happening to hospitals. They're all over the place. So is it worth it? Do you even try? Well, yes, there are a lot of proven benefits. There was a study of 11,500 patients at the University of Pennsylvania Hospital and Penn Presbyterian Medical Center. In that study, they found a 14% reduction in overall patient stays when care coordination was handled with text messaging compared to those patients whose care teams used traditional paging services. During the study, a wide range of text messages were sent through a smartphone app to and from the care team. This involved nurses, residents, attending physicians, social workers, clinical research coordinators, pharmacists, and unit secretaries. When compared to certain floors at the two hospitals where care teams paged one another, the patients whose care teams used text messaging left the hospital 0.77 days sooner. Now, this is an example in a hospital setting. Many of you on this call, in fact, probably all of you on this call, are participants in an ambulatory environment, and you may not see how this might benefit you, or you couldn't conduct a test like that. So I can give you an example that was just shared with me from one of my coworkers. She had a very, very ill child and needed some significant surgery. Once the surgery was conducted, and it was great success, the baby was home and noticed something from the wound that was very alarming. She had a relationship with her surgeon where that they were texting back and forth, and she was able to take a photo of the wound, send it to him, and it turned out that it was a particular type of stitch that was coming out, and there was nothing to worry about. Well, that set up the decision. It helped her and eased the angst that she was feeling at the time, and on top of it, it saved an unnecessary trip to the provider or to the emergency room, and in the end, everybody was happy, and that was all through the benefits of text messaging. So the bottom line, the risks associated with exchanging EPHI via unsecured text messages are significant, especially in light of specific compliance mandates such as HIPAA and HITECH. However, it is possible for organizations to properly identify a secure text messaging solution that satisfies the clinical need for faster, more efficient communication while also meeting IT security and compliance requirements. As Lindsay mentioned earlier, we have looked at a number of different solutions. We have not vetted any of them, and we're not here to recommend them. One of the things that I think that needs to be considered, if you're really going to deploy this, this might be something to consider in terms of getting a solution that will take care of many of these risks associated so that you don't have to. You know, maybe you don't have to worry about whether or not Facebook. If you can have everyone texting EPHI from a certain program or a certain app, that might solve your problem. A few of these that we've looked at are Tiger Text, Doc Halo, Athena Text, Voicera, NetSphere, and Telmed IQ. Lindsay and her research, and she did most of the research for this program, indicated that Doc Halo and Tiger Text seem to be the most popular in terms of just how often they were coming up in the search engines. With that said, we have not vetted any or are not here to write a recommendation. We just simply want to give you some ideas of where to go and how to start. So from that perspective, I think that this is where we need to go. So if you're uncertain where your practice stands about this, HIPAA, meaningful use, or anything, let ITENIV help. By assessing your current readiness, we can provide recommendations, help you search if you don't feel confident in looking or vetting how many of these things needed to be addressed. We can help you with implementation of new processes and procedures. Next steps, if you want to learn more about ITENIV, visit us at itenev.com. You can sign up for our informative webinars and blogs. Consider one of our 3-day fixed-price on-site consultations, clinical workflow, revenue cycle, and front office, technology and performance, or we can customize a workflow for you. And then you can test drive some of our products. So finally, if you have any questions about what we presented today or anything else, we're here to help.
Okay, thank you, Cindy. Thank you, Lindsay. That was some great information. So we're going to open the floor up to questions. Again, you can type any of your questions in the questions area of the GoToWebinar control panel. And you can always reach out to Lindsay or Cindy, the information you see up here. And later this week, I'll be sending out an email with a copy of a link to a copy of the recording as well as a copy of the slides. So if you have any questions as the week goes by and you're like, oh darn, I should have asked that, don't hesitate to reach out to us. That's what we're here for. Okay, so the first question. Several of our providers text message with patients. What are your suggestions for text messaging with patients? A patient would not have a secure app on their phone.
I'll grab that one. Basically, I don't know that I have a firm recommendation. That's very common, and I'm dealing with that with many of the clients we work with. What I would recommend is that you look into one of these programs that allow you to have those apps, and then the patient can download the app if I understand how they work. And again, they're all different, and some of your solutions, some of your IT vendors, depending on the size of your organization, may already have something in place like this. But if you look at some of these solutions, what they offer is it's an app, and you would perform those text messages from and using the app. And that would be the best way to do it. I can tell you that just texting back and forth with a patient, in the example that I gave you for my coworker, okay, that's a perfect example. I don't really know if he had a secure solution or not. I know that it works and I know it's beneficial. The patient is obviously involved, so they're releasing their PHI. So there's an implied release there. You know, there's a lot of different things I can tell you that's really something for your own compliance officers. The best and safest thing is to find a solution that all of your ePHI is moved back and forth there. The other thing too is to never put in the patient's ID number, never put in the social, never put in the birth date. You know, if it's just from Susie to Joe, then really probably not a lot of harm done unless that device is stolen. And if the device is stolen, make sure you have passwords on it and you have the auto wipes. I can't speak to every cell phone out there. I personally am an Apple person, so I have an iPhone and I have all those things set up because in our company that's required. So those are the best advice I can give you. The biggest thing I would say is research some of the programs out there if it's going to become a prominent part of your practice.
Now, Cindy, can you clarify kind of a follow-up to that? As far as PHI that would be on the patient's phone, that's out of the doctor's control, right? Once they send the information.
That is absolutely that's out of the doctor's control. So once that happens, but keep in mind that it's, you know, there's HIPAA compliance and then there's HIPAA violation. You're not in violation unless something happens. So in reality, it would have to be the patient's, you know, if the patient's phone was stolen, etc. That's not going to be your fault or your initiative. And honestly, the patient probably wouldn't even give that a second thought because it's really going to be just about them. It's more about what happens if you're really, I think the biggest risk is when you're communicating professional to professional and what the information is you're putting in about a patient that is not a participant in the party or the details of what you put into the patient. So if you put some clear guidelines, as it said in the policies, I think you would be fine. Again, my advice is look at the applications, though, if this is going to become a prevalent part of your day-to-day practice. Lindsay, do you have anything to add?
No, I mean, you pretty much covered. I did see we had another question come through kind of as a follow-up to that as well.
Oh, no, go ahead,
you want to go ahead and grab that?
No, go ahead.
To that. The question just asked, basically saying that when you send out using a population health management application and you're sending out text for appointment reminders, how much information can be shared through that? This is where things get tricky. I mean, when you're sending out those messages, that's not technically considered patient health information. I mean, that's not that PHI we're talking about in HIPAA. If you're just sending out the time of the appointment to a patient, you're not actually releasing condition-specific information. You're not putting out there their social, their birth date, any really specific identifying factors. That with that kind of information, that's fine, and that's able to be sent out. If you're sending out a time or a location with the patient's full name, that's not really what we're concerned about being leaked here or going to be considered a HIPAA breach if anyone gets their hands on that. It's more or less actual information from the patient's medical record or anything that can be identified through their specific condition. Again, there's a lot of details that go into that. But if you're sending out reminders through text for population health management and appointment reminders, I would not be worried about that, of sharing too much information.
I absolutely agree. Just don't put in why the patient is coming. You wouldn't want to put, you wouldn't want to come in that, you're coming in for your initial OB visit or anything else that might be sensitive. As long as you're just putting in the time and the place and the provider, there's nothing any different than that than you get a text message from your hair salon or your massage reminders.
Okay, next question. Can HIPAA compliant texting replace a paging system at our practice?
I can grab that one, Cindy. And my answer is that's really up to you. I mean, texting has the same capabilities and a lot more as a pager. We're seeing this evolution really happen and kind of this change taking place from paging to texting. The key is to make sure it's fully integrated into your workflow. So the primary reason we've really heard of replacing pagers with secure texting is efficiency. I mean, pagers, think about it, you get the message and then that requires the recipient of that message to actually go in and phone in to complete the communication change. So Cindy, if you disagree, but I think basically the main thing about that is efficiency, and pagers are kind of limiting your capabilities with communication.
I agree.
Okay, next question. Are we out of compliance if our lead tech is using a phone to text our doctor a question regarding orders or testing for a particular patient?
You kind of cut out on me.
Yeah, I was going to say.
Yeah,
oh, yeah, sorry about
that.
I'll repeat. Are we out of compliance if our lead tech is using their personal phone to text our doctor a question regarding orders or testing for a particular patient?
Is the patient's name? You know, it would largely depend on what was in that text specific. You know, name, birth date, how deep they went in identifying that patient. That would be an example that I would suggest is something you would need to take a deeper look at in terms of either with an application or how is, you know, for example, if you're texting the doctor about details or something regarding the test, you want to have clarification. You get the clarification. How is that getting translated into the patient chart? Either, you know, handwritten. There's a number of things that come to my mind in that one. So that's a perfect example of where you might want to take a little bit deeper dive and take a look at it and maybe look at some of these applications, or at least have a policy on file as to what happens if that gets lost. Are they deleting it? You know, again, there's a number of things that that I would want to take a look at. That's one that I think is really almost the subject of this webinar. I don't want to tell you you're out of compliance. That's not my job, but it's something you definitely want to take a look at and you want to see what's being included.
Right. I would suggest think if HIPAA came knocking at your door today and asked for an audit, and they asked you to prove how you clarified this patient information on this test result, how would you be able to prove that you actually had clarification from the doctor and had confirmation? If you have a policy in place where those messages are encrypted and they're able to be translated into the medical records somehow, then, I mean, sure, that's great. I mean, there's a lot of different things that go into it besides just kind of looking at what specifically can be texted. So that would be something.
I would definitely take a look at that. Take a deeper look as to how those messages read.
Okay, and it looks like we have a follow-up to, I believe it was to the Pop Health related question. Would that include reminders via phone message, or is it a violation to leave a message to call the office if anyone other than the patient answers?
Well, that's come up. That's not this webinar, but I have researched. This is Cindy. I've researched that a few times myself, and I also get voice reminders. And basically, they just leave a message. You know, the way that's handled with my doctor. So I'll speak to what I think needs to happen on that, and we can actually research that. That's a great topic for maybe another webinar. When I sign in at my provider's office, they ask me if I am allowed to receive calls, what number to leave call, and is it okay to leave a message, and is it okay to leave a detailed message? And they ask a series of questions that I answer. And if I answer no to any of those, then I either need to be taken off that reminder system, which is how they handle it. And if I answer, you know, so if there's any restrictions, because if you're using a system such as Televox or some of the newer ones have bigger capabilities and bigger ways to restrict based on some of those questions, but as a rule, you send the information to them, they make the call. So, and the way they work it is if anybody answers no to any of those release questions, then they do not send the reminders that way. They just do not handle those reminders. They have to make a physical phone call, and the person making the call knows that there are restrictions on that account. That's how I would handle that. I don't think you can just have a blanket answer for that one either. It's going to vary to what the patient has agreed to be released.
Thank you, Cindy. Okay, we have another question. Do we need to have a business associate agreement with each of our providers' mobile device carriers, such as Verizon, Sprint, AT&T?
I'm going to let you take that one, Lindsay, because you researched it. I do know that in telemedicine you have to have a business associate agreement, and Microsoft actually has one for telemedicine now. They didn't used to with Skype, so now you can actually get a business associate with Skype. So something like that, they are there. I think the recommendation is you do need it if you are going to use it, but I don't think you're going to get one with Verizon or any of those. Lindsay, what did you find?
Right. I would say, so we did actually research this extensively because we had the same questions along. So what if you're using an iPhone? Can you get one with Apple? I mean, it's along the same lines. And I would say, again, it varies on what you're using it for. So if you're going to use Verizon and you're stating Verizon is your secure network and they are protecting your data and that's why your data is secure, then yes, you would need the BAA with them. But if Verizon is just your provider and you're actually going through an application on your phone, then you would not be using that, technically, that service to keep your data safe. and I would say no, you wouldn't need one for that. But
and I would
on the
agree with
safe
that.
side, you're always going to need, if you have a BAA on file, you can never have too many. I mean, if you could get one from them, but again, it depends on what you're specifically using those carriers and those providers for.
I can tell you, unless something has changed, Verizon is not going to sign a BAA. They're not going to.
Sorry.
It's not that they don't, you know, but that if you think about what your BAs state and what they're assuring, the VA partner becomes equally liable in the you know, if your phone was stolen or something. So to take it to that level, that's why looking at these providers, if you're just using this as something, you know, as between the pay, there's a high benefit to this. And I don't think some of these app companies are very expensive at all. Again, we're not here to recommend any one of them, and we haven't dug in. We're actually going to start researching those. It's just we started preparing for this webinar and got the names of the ones that we have found that seem reliable. We know have BAAs and do the things that they're supposed to, do the things that we know that are necessary at a minimum. We haven't looked at cost or anything. But I think if you're going to really incorporate this into your environment, and it's a really positive thing to do that, I would definitely look at a solution as to how you can do that. There's just so many differences on so many phones.
Okay, it looks like this is our last question, but if you have any more, then we'll hang on and keep answering them through. But at the moment, the last question says, what does rest in transit mean? I heard you reference it several times.
Okay, on a phone. Okay, go ahead.
Or go ahead, Cindy. You got it. Go for it.
Okay, I was just going to say, on a phone, just like on your laptops or anything, in transit means while it's going from point A to point B. So when you hit send on your message and it goes from me to you, the time it's in wherever it is in transit. It's going between the devices. At rest means that after you've sent it or while you're typing it, it is sitting on your device, and that's at rest. So the security has to be in place for both ways, while it's in transit and while it's at rest, which is why this gets so hard and so many of these applications are coming up. And once again, you're not in breach unless something happens. Unfortunately, if you start using this regularly, you can be considered in breach. So that's important, and that's why it has to be encrypted in both places.
Okay, well, thank you, everybody. It looks like that's all the questions. But again, there's contact information up there, and you can always reply to our emails with the slides and recordings later this week. Cindy and Lindsay, thank you both so much for all your effort that you put into this. And everybody have a great day. Thanks for joining us
And I wanted to say thank you very much to Lindsay. She did all the research on this, and you got a lot of valuable information. So thank you very much, Lindsay, for making it look really good.
Well, thank you, everyone, for joining on today, and I hope everyone has a good day. Thank you.
Thank you.
Bye.